First place, yen fa nipadua no. Ye ka kidney no a ene dean e wo nipadua no.
Yo, me da se pa mechia watiefo nso. Ye ka kidney na ye honama ko a bi a eboa e wo kwan bebre so. Na nyame ye wadom a obia wo mienu a wo ye chi honom baabi. Nti oba na okidney no ho atochima na osi ye hu bibia. Panie no na me defa wachi nti ben echi endim. Na basically no obia wo mienu na wohwe the way a etia akoya sedua no gobe bean. Okay, that's how it looks like. Na kidney size no enshada nso sa nti obia pagya na nsa ekbokuturuku a o kidney no is about the size of your fist. Okay, so you have two of these things etua wachi eboa kwan bebre. So then o kidney ni ho a untime nyonso. The kidney no the first thing amanfo nim na se eboa ema wodwonso. It is a wodwonso so na untimi nhu anase wodwonso ni sesa the meaning say ebia na bibi koso wo kidney ni mu. Na the other thing nso a kidney ni ye na se eboa ema unipadua ne ye moja. Enti kidney no na akoye se signal a umoja so te a obeka kire nipadua na part na ye moja na se moja na so ate ye nye bi nka ho. It is a kidney ne nye adwuma umoja na so te a akoye se wo drive your car na o fuel gauge enya adwuma. Thank you. That is how the kidney works. Enti kidney na ma signal no. It is a signal ni ho a umoja na so te a body no encourage nchire obunse onama no abre o ye bibi kakra no abre and all. And a kidney no a eboa ma oye dwonso tanko se onum nsuo a odwonso meboa.
Yeah.
Se kidney na nya adwuma untime nwonso enti nsuo kakra bi a obenom na ejina mu. En na omo yare a emo omo na ase pagya no obedu ba bi a obeka se untime kra nhome. Untime nhome na se nsuo na ejina ni mu no akona hrawa ne mu. Enti kidney na eboa yie pa. Odidi anopa ewie anwumre duani bia obedi bia content e wo mu no menye sure ye nyina ye we obi anhwe content no but kidney na eboa hu se this particular nutrient no e dose dodo wo nipadua ni mu me anwunso na ebi nko we na so ate let's hold on enti kidney no maintain balance in most of these things enti na se anya adwuma efini nyina e wo nipadua ni mu a na obofuno na ofe no sa na wanwe ni ya okose o mebofuno mefe a yesi malaria obehwe na nya malaria ebia na ye kidney na ekoso most of my patients eventually oma be do ye ho no obeka so okọ ba bi na say malaria because sometimes malaria pa but then eventually kidney na ho odin na yeden akofo. The next thing so udompe mu be yeden usin be yeden calcium ne phosphate ne sa nemu ni nyina kidney na controlling to nim say so vitamin D obi ehia ukọ abonti na wi abo kakra but without the kidney your vitamin D is useless. Kidney no na a converted vitamin D into an active form. Our body ni betimi use na udompe eno o sin anything that has calcium no etimi aye. Now the last thing I make say kidney no ene boa eme control blood pressure.
Okay.
So kidney na ho den na form ha o pressure na kosoro a ontimi control no. It's one of the common ways etimi hu so obi enya kidney area ne say the pressure be den ebe kosoro. Eti unhu so be pressure kosoro not because ebia wanyi obi the 60 years and all if it's your body na asesa and pressure na kosoro unyi obi a we di 15 years 20 years 30 years and the pressure was right the first thing was here sure na say anye bia kidney net sign.
Wow.
Mekasa sa no bia yedin.
Wow. No, we learn from experts to some more no. Mo che ade se a na eboa enti ade in the mark kidney no ehotimi ka
no correct. Okay, so o shase no ma preamble bi efa nkwala no ho because of near me professor ekan prof Entry din na Entry wanka ne ye the professor Entry eti nkwala benya kidney area typically no ebia na efi awo mu imma ni bebre wo ho no mo a onyinsen anaso onyinsen early stages na onim. Now the early stages of pregnancy na nyina beginning to form.
Yeah.
So obi ohonoma we messing the period and I be okra on shada mess papa as of that time na ono no monro as of that time on hwe no ho so yie. So at that time no if the beginning of the formation of akwala na mfa chances are that by time I be wo akwala no how.
Okay.
2 The other thing is say obi ohonoma o hye onyinsen a obekọ hospital am ya hwe that the ANC no na ya hwe nyinsen na bibi ko yi there be obetena fie sa onko good yinim say ya re bi oho a eto de bi a affect yemma no ewo nyinsen mu aye friend preeclampsia or hwa eya call the third trimester second ending ho third ho no na BP na start ekosoro na BP na start ekosoro na nka o ko ANC a yebetimi apeki ebema wadro BP no beba form obetimi awo afa ho afa oba now so won ko hospital mo obi ncheki BP ni hu a ekosoro no na ha akwala no it one of two things either ufa hu dikrapo akwala na obewo no either so be premature and also be low birth weight na nhwehwemu a kire yen se wo akwala na wamba at term no ba before term and also obeba na ne weight na nya ideal na a low birth weight what it means na say ne requisite kidney na wasen conform ni yie no wantimi amform ni yie into ono ba be sha ase aba Ghana ye be wo na oba be nya ne malaria na nnuama no already ne kidney no de be sha ase 100% ono nam 60 dada na wenya malaria kakra na wenya infection kakra na ne ma men so esana kakra na ye ma ne bibiduro bi a itode bi a ye nim the effect on the kidney so kakra it is an nnuama ni nyina bobo no akwala ne be be 5 years maybe 10 years maybe 6 years no na ne kidney now the sha ase no sesia no ho aka the other very common thing is say oh jonso ankwala typically mema no nka ye jonso there isn't supposed to be any valve e wo kwan e be fa so e be jonso ba nkwala ne bi wo ho a valve say e bia won say say bibi ko nanimu a eto de bia o say ko nanimu nko a eni say bibi stopping aha eti wunya bibi stopping in the middle of it na jonso ni nyina mma won say akola male child e bia be 2-3 years or jonso no kem or jonso na ye na ya or jonso kakra bia nche na jonso de no tete bibi ekoso jonso twa animu wan hwe ni ya anhwe a wan hwe ni ya sa akola no be di be 10 years no na ne kidney na ho den no ekokojo to and it happens to be one of the very common reasons nkwala mema especially enya kidney area. And then the other thing no so say na me kan no ya wo ama wa ba wiase no mum no ewie no obi a ye wo bibia ye kama unyinsem mo ma me anu medro bi ana bibia ha adwen bia nanso akwala no oyarea wona ne kohemfa. Because what we know, let's say, simple things like malaria, simple things like infection, anytime akwala ne benyano, unya effect kakra woni junso mu. Adentia, unse unya malaria so junso eni ekoko. Unya malaria o junso eni ya tuntum, eto de bia junso no kra swate. All of those things shows that kidney ne ho chire no. It is the frequency at which unya these conditions over a period of time no and also affect the kidney. Affect the kidney. And now me bana ya na complaining ni haya ne ya na makoto painkiller mano. Na makoto painkiller mano. Na makoto painkiller mano. And also na ha kwala no. So from kwala na bit no these are the things that we get concerned about. Tina kan akwalasa onno monsa onno monti enye se insan lifestyle asem there be things that may have occurred in the pregnancy and then after delivery which leads them to get the kidney area.
The all kind just enye hereditary.
In fact, and not in the next one, Ameba. So, indeed, sometimes hereditary dear no, sometimes at affecting kwalano in their younger ages. Hereditary dear no affected later because it takes time to build up. But could be a friend of polycystic kidney. Say, insure gina kidney ni munti. Why a scan? Yes, so insure gina kidney ni mu. And non here it through no fault of yours. Oh, mommy and now papa ewo gene nibia and I say sa sunibia. Near yana say or wuwa unyino wedi 20 years and above aircon all of a sudden na sister na start eba yin so nkrofo sa no unya hum nipa ba ko a also hwe ebusuan ni nyina because meaning say obi wo ho no ma ebia eventually ono so benya kidney area. So what I keep saying na say eto de bi eja e hanom so obi wu a na nkwala ekon ejapade ho. So what I actually advise na say as you are fighting over parents ejapade omo ejama wa hu no please be also concerned about ejapade already from the amount without your knowledge. And trust me, if unim so mami a diabetic, unim so papa ewo sicheriare anasa or pressure anabibia. Menkasa masamba, but the risk na say the chances are that unsubeti mienya. Iti uhu sana na o start that's why lifestyle no be muno. O start bo bra ye inti umame yesi onten nchine so. O de o say umame nkwa na onten nchine so na mwati na aduane esi nchine nka ho. Na wo de udi nchine no. Mind you, by the time you get to the age sa pressure na diabetes no. Now so wenye bi. But the idea na say uhu say umame yenye bi. Onyano at age 40. To see you are age 30, ukra BP won check it. O de o check here na o start te won chene so a. Chances are that one hwe ni your pressure no ye den. Unye bi and as a ubenya kra no later what in life. So these are things that you bet me here. But yes, kidney area and some can be hereditary. You timid the through no fault of yours. Let not people sit and say, oh, it's an air can kidney one some a you obiasum. I told you a hard obi say o obiasum. What he was this year, my statistics be say na friend the CEO no can say 17%. To be honest, I don't know where the 17 came from, but what we know is a 13%.
Okay.
So that 13% of people with kidney yaria no who work it up, assuming a population of about 30 million, what it means some about 4 million of us have some form of kidney yaria.
Now they give us 5 million.
Okay, now yes. So some 4 million. So at least I can back my own data and so let's say about 4 million people have some form of kidney disease. Now, so 4 million and dialysis. So there are various stages of kidney area. No, yehun and tama yetimiso ano. Tanko, me sure say oba o charge you phone.
Sure.
Eti u kasa na eso tenka kra. Eti e bia mehwe me phone so sesi ano. Oh, e bia me du be mentimi an charge na wie nra kasa bebre enti. They say about 60% me phone. Man hweso a nka me hu say 60%.
Yeah.
Sa na kidney dey there. Kidney no is an amazing organ na e betimi abona adwuma nyina kama until it gets to a point afi ne ho kire no. So from 100% to about even 15%, and my own susansu bia. O de onam ho ye o ye active o ye obi bia. E be do 15% na afi na kire o se afi o ye bibi kakra na wabre o Johnson no na so ate anase oni echi pejapejia anase onase pejapejia na bibi. Normally na manfo twen na sa ansa o makwa yare sabia. Near American say mami and train because the prevalence is very high. So don't wait for it. Once a while, go and check whether your blood pressure is high, whether your sugar is high, and then how our kidney net here. Because blood pressure, for instance, check here. In America, tell from beginning, a more fair idea of how your kidney is doing. And our blood pressure also happens to be very common in Ghana. On the average, ages 18 and above here in this country, we nipa mi and sembia nipa bako blood pressure.
Wow.
It's here me and Sunny O studio ha Miss Roka. It's only back row don't pay all right. But then that is the thing. The pressure and also entire mass symptom bia. That is the danger. Never na cause kidney area pa no analysis and never na show no and mass symptom. It's what you ho me ho ye no. Dakura beka se enne me ho nhye dam fa me no. Wo beko no. Yes so kidney na ho den no 6%. Me then I'm feel me you. In fact, na me AEB on your sister station, I think it was Joy. And patient Ebeka say, near Okan said the only reason tell me who say kidney area one or so say the 9 ekobo bibi no prayer. And no they call hospital. And a hospital season and saying because he who's a pressure and doors into obai, you better check your BP. It's almost check here no moon so pressure no also. A horn and commodity na shas here. Eventually, dialysis so. Oh, into the all customers so when they're not an active guy, power. And I go keeps on saying the fact that you are active does not mean your kidneys are healthy. My boss will be the fact say ye uti me ye obi bia me kwa adwuma kama ba eno nkyere say o kidney na ho ode ne ye me hu nkrofo bia o kidney na kofom amo pressure omo working gear omo de kwa adwuma anopa yes so ye adwuma all of a sudden na brim all of a sudden na half ko ye be ba no ye be nunum no ne pressure na onya na ye kidney are na ama pressure na kosoro na odi nya stroke o hye na tare o de kwa adwuma na ne ho ye pa ono ano ko ye ono ano drive ko ye nanso ebia no ntimi nko and we see that a lot intina normally I always take advantage when ye nya opportunity say amanfo tie mo pa ye kasa me sure say ye kasa obi tie kasa ye obi inti nneema ye kan na ontu hu anamo ye obi yare
we know there kana be there
kidney dia ye busua mu and me mbisa obi a say ebusua nim obi o kidney da bi anya bibia ye hwehwe Jitanko, normally I say a kidney no, it's a very neglected, non-communicable disease, but it's such a killer.
Yeah.
And it's expensive to treat. And that is the problem. The best we can do is protect ourselves. And then it means numbers never down. Hopefully, then we can push government to support. I feel government can support.
Lifestyle being lead to Emma obeso kidney in your problem.
But I say, the first lifestyle mechanism, we live in an I don't care environment. You see an average person, oh, media menko hospital. Yeah, then person and no, honestly, people get satisfied saying,
5 years in the
menko hospital that. Oh, bad time. Oh, yeah, warm me. But tanku. Sa nipa ya menene ka say na sesia no we nya kidney area me ba be kan kire ne sesia say ohia dialysis ochina. But all along, oh, me dem see hospital da. Eti ne ho dodo ne kakra na ne ya no ape bibia nom eno nso eno ne another ye no ebeba honom. So one, lifestyle and say we don't seem to care about our health. We don't put health as a priority. Me sure say me bisa o tanko shoe size here den obeka kire me. Oh, me catch say oh, me bisa say oh, ebia oh, waist size here then. Ebia I call tailor honche into check here okay. Na me bisa say for the past 1 month, what check you BP da. And now oh, sugar. Oh, now kidney na ho dey American in percentage terms. Thank you. That is it.
Yeah.
So we care about other things, but we don't care about our health. And mind you, sa tare no untimi nhye, sa shoe no untimi nhye. Oh, your ba unimu bra size pa, oh, esesa pe unim say sesi asesa. Now so unimu weight. Asam. So that is the first lifestyle that I feel it is very dangerous. We need to care about our health because kidney area no you called conferences when people are talking about the fact so amount for average ages and I'm 16 17 no tanko. Yeah, they are 45, 46, 47 average age.
Ghana.
And here can there are young people and 45. And 45, can you imagine when life indeed has begun? Where you are supposed to now good.
We live a good.
Thank you. Then all of a sudden you are coming 3 times a week on dialysis and your life is all a mess. So it is important that we realize that let's take care of ourselves. Don't wish it off. Obi wa ka say oh mama me pressure na watch you that oh look me dey me bomb pie tafia kwa emma me so. Me ejidi ni pa. Me bomb pie ba me so me nim say nyame e na ama ye nyansa say ye dey be den. Ye be hwe mo. So ne ya be kan no amanfo ntia. To be honest, so that's the first lifestyle.
Yeah.
2, what are we eating? It is the content of what you are eating.
Okay.
You can eat your wache very healthy, but the point is a plate no carbohydrate no in the wache no and no na aye aduane ni nyina. Ana say oh wache ni kakra. Oh when your leaves kakra. Oh, when you wake kakra, uya wape kutumi nubi ana banana bi aboso. That is healthy. And yet the sradenam and the oil and the meat bebrebe. Of course, now we namni bebre na just say nyame shira just say But what you should realize is that most of these meat in the they are inflammatory. There are a lot of acids in there, and it puts a lot of pressure on the kidney. So all the pressure air to kidney so over a period of time, then you are calling things upon yourself. Now cholesterol so cholesterol also affects the kidney. So then what you doing any the quantity so I do. Who says we should eat 3 times a day? Obi ohano mo we didi anopa 12 abokomek ran no edu awia osmisan didi. Wo didi nso anya sa wodi ko tumirika ana sa wodi ko ye walantu walansa. Wo de tena ba bia wuti ya. Na eba sa afi we furu ye kese a tanku. Wuti me de hye hwan. Wuti me van show bia. So the point is say whatever we eat eduane bia ye bedi no, we should be able to expend the energy.
Okay.
Body, the way I say, I just keep imagining those times when our people used to go and farm, and I say there are times where they probably are not getting food. The body has been made such that it can withstand times eduanini ho.
Okay.
Banyame ya dom. Oh, benye bi edi anopa, benye bi edi ewia, benye bi edi enwumre, edi bi anajo. Meanwhile, umfa ntumrika, umfa nyahwe. Na enwane se u accumulate all of this fat which eventually affects the kidney.
Yeah.
Na enchine so. Enchine any pressure they are bedfellows.
Okay.
Intina obi nya pressure is on your day. Until enchine so. Me make say aden na metwen tanko amwenya pressure and some kase te onchine so. Inti yen nyina yen den. Yen sha ase enten yen chine no so sesi a na yen nya pressure no. So these are the key things with what we are eating. Na yen num nsuo bebre. Water is life, they say. Ukide na won bedum pempen so bi na nya adwuma meka settle men num nsuo kura. It is a see hopefully me no ka say here na say wa utie me here. We hope so ukide na won den yen there. Drink a lot of water. The more water you drink, the less stress you put on the kidney. Kidney no adwuma na say obe concentrate o nsuo na wa system ne mu in case onam Sahara desert. Na ona nam hana wo nsuo a numbi Now Johnson no hu no yen den ento. Say na bia no more water. In fact, what I keep saying is that the closer your urine color, or Johnson color, is to water, the better for the kidney. Once a Johnson or Johnson near a meaning say kidney no a hold on or year juma. It man year juma be brain so with time no. Thank you. So let it relax, get it more water and then more cleanly. Now and cleanse most of the toxins out of the body. So basically, that is what it is. And then another lifestyle, painkillers I know. Because to join me, hospital for a reason. Inti Rebecca say, oh, no painkiller no for 5 days. Yenim. And yes, sir, you trimu no heading. Your mouth for 5 days, because you say your mouth for longer, it also has effects on your gut, on your kidney, on your heart, and so on and so forth. But what they don't know me a farmer. Instead of odo ho ba kwa kire say bia pain na nyanko anwia na bibi no afi wa kita container no now the nam one pharmacy shop na we na ejime we na ejime na onum ko trust me, all the painkillers most of these painkillers no, there are some of them that are fairly safe. You bet me ama wa affect kidney no, but most of them near typically ya draw muscle or so na joint near in fact my fapa ama no, those ones affect the kidneys. No I told you antibiotics bia yen de ma me kan ye first yen de ma na say sometimes can affect the kidney. So ansana ye de be ma no yen check your kidney no function no. Who say, kidney function and I'm 60% into way. I say no mienu anopa mienu ya mienu nwumre no. Who de na ye be no ba kwa anopa ba kwa nwumre. Ya ye hwehwemu na akire yen sa. Inti ye mawa we are careful. Inti na we are guided by all of those. Inti again onfa wa ope enkonom adro. Make ya bear for no that it can affect the kidneys. So when you try, we are mindful no. Anye bia ebibidro na ye nomo no. Omwa ye nhwehwemu ehun se anye bia kidney na hoden e was 60% a ubetimi anoma na. And nam 25% a ubetimi anoma na. If ye nye san nhwehwemu na dia utie mi ane meka ne se no ma be careful. Di aduane kontomre ne nneema as vegetable as food I don't have a problem. Anytime you want to call something medication, what it means is it is potent. And one of the things with potency is it comes with side effects. You cannot have a drawer a year potent, but no side effects. There's nothing like that. So I quite say South Korea, so now they've created a good nuclear bomb that is potent, but it doesn't destroy anything. How? They're bitter. So there are always collateral effects. So the point is say, nom sabi bidrono and some of sabi bidrono menkani. Some of do you know? Near area kidney na nima. Please be careful and stay away from it. I think that's on the and then exercise makanwasem. We've become a generation of sitters. Yeah, sorry, ni atena ye car money akotena office ni atena ni ye kesi ye exercise na nnuama. That is not healthy at all. And then again, it is important that once a while pass by, check nnuama. It is okay. It doesn't cost much. Indeed, we 150, say 100. Who decided so the whole year? Who save 10 cedis a month? 10 cedis a month. At the end of the year, you bear 120, isn't it? Yeah. And decide that, I'm going to check from these things. Your toe, thank you. Everything. You team able check at least. We check pressure. Pressure nebo anyading. Sugar nebo anyading. Kidney na ibi anabo den kakran. So at least at 120, it should be able to take care of these basic things. My check it this year. My birthday, na me check here. Na me kidney percentage you see. Na me pressure you see. Na me so and so you see.
You keep mentioning me percentage, 60, 80. At what point?
Yeah.
Kidney, for example, we be a mako. Never be what kind me say me do for. I won't run away from. I never come here one day pa. Yeah, it is every year I check my HIV status.
Because and so Sunday and this is checking the babies. I'm best.
What did not go? But there are other ones,
yeah.
For example, we make Kaipa check my kidney like 3 times. To be frank, I check. And what I think it should be part of.
Please do.
The checking.
Yeah.
But at what point percentage bank and I check here and say, Kwame, say, kidney no. Oh, it was 80%, it was 60, it was 70, it was 40, and they are alarming.
Okay, good question. So typically, we, in terms of definition, we get worried. I won't use the word alarming. We just get a bit worried when it is less than 60.
Oh, okay.
But again, it depends on umfia wedi. With the 80 years, 70 years, now when I'm maybe 60, in fact,
okay.
Exactly. With the 15 years, now I'm 61, so these are things, and of course, that is why you need to see an expert to explain it. Because numbers, the explanation goes beyond the numbers. I have seen people who drive all the way from so and so because lab no yam so and so. So then the point is, when you are doing it, make sure you have a healthcare provider who knows what he is doing and will be able to explain to you, like you are saying. Yeah. So typically, if you are doing above 60, let's say at your age above, I will not worry too much. Okay. Of course, I'll try and find out bibi or one more bit me aye. Me say tanko it me exercise kakra nanka weight height the way it with me 2 weight so be say me sure say e be pagya kidney na ho adi ni mo. And now say it will also guide me to say okay ma me hwe Johnson no so hwe ma me hwe bibia and me hu say bia infection bi Johnson you treat you ya boom na fe na back to 80. So the point is say when people come early, there are a lot of things we can do for them. Omo mantama ya na ha adwen.
What was stages?
Your stages 5.
Fire room where
okay, so
the minimum say end point. End stage.
So for public health consumption, yes, how can it be brilliant? Now people are confused. The end stage, is when it gets to less than 15. So that is where now it becomes alarming, because that is where now the discussion goes beyond koyese,
but straight
becomes dialysis, which now has become the topical issue in the country.
And from stage so for
normally so from stage 3 onwards now I can't 60 stage 3. All right, so stage 1 and 2 typically they are working around, they are fine, probably we don't worry too much. And I make it all depends. We say I can say kidney function maybe 5 years ago. I will now use your baseline as a standard for you. It's in the last time 90, let's say. Now, if all of a sudden you're about 60, I'll worry, because what it means is it has dropped. So I'll start asking myself exactly.
All of a sudden,
good. But if the last time, now I'm 59. I feel now I'm 60. So I was like, it is stable, and stability for us is good. Yeah. In as much as it is not getting worse by the day and it is stable. Actually, I've had patients they were referred to me because they thought they were in the end stages.
Okay.
And then we found, you're diabetic, or you say, the sugar now infection or has so and so in your soul. And indeed, he has actually been in that stage. Papa, I keep saying, before crying, not the diabetes, and one under the kidney disease, because for the past from 2017 or so, I'm sharing until now, so 6 years in here, he's still stable. Anytime no oba ni ahwe where unya yenti we correct it back to where it is. So it is so important you really get somebody to follow this.
Now what is dialysis?
Okay, so you can't dialysis now basically unyama ni bi anya ni nyina me kan say kidney ne ye no ene yakofa efidie ebetimi aboa wo nipadua no amana yesa nneoma no amano. So kidney na ho den no do 15% now. What that means technically ni say if we be aduane mo ne drinks mo ne nnuama no it stays aduane nipadua ni mo. And no na mo bofno mo fe no. Normally example am man say I say wadwonso egu kuraba mu na wo de esi wudem na for the past I don't know say 1 month unhwemu untimi ntena dem ho unya bowra ope na obofno good. That is how my typical patient feel. Sa de na uko bowra ma wote no and na omote owo mu nipadua mu because e fini nyina ye den etemu enko ba bia. And that is what they feel. Nti no machine no ni aye na say ye de be yi sa fi no. Nti omokoda so be 4 hours. Ni aye na say na moja no eba na kofa bibi mu na eyi fi no over a period of time and kakra kosi time e fi no be bad down. Nti na uhia na time bia because usan ko didi bioma you generate more fee and the machine has to take care of it. So na otwi bia no 1 year kra na 3 times we advise.
Na no ye kidney na adwuma no.
Ye kidney no adwuma ni bi. amano. Efino and insuno.
And I used to say so expensive.
It is expensive, unfortunately.
It means say boy home by because when you're way free, a kidney in here you are free at the mouth. Now I'm protected and more home buying. The oko daso dialysis na mana boa kidney no a support no very expensive.
Yeah. It's you see Kolebu previous numbers no cry, let's say 380 and let's say 400. What it means is say now what should be 400 times 3. That is let's say about 1,002.
Yeah.
Ni omeka 12 million. But so maybe times 4. So
12 million.
Yeah, easy. Now what 12 million. Now 12 million no say I'm very careful say me see a kidney na juma ni bi.
Yeah.
So niaka no or see a day enroll
A support.
A support here dem panie a support into okay no so boom the cost no I was wrong. Intina they say 1,002 to urinate is what machine be amount. As of now, anytime Albert Johnson and watching no, I will show kidney so ye no opportunity cost that you are saving 1,200.
Doc.
Yes, sir.
At the prime minister, say you have other engagements.
Yeah.
Yes, so we are so much grateful for your time. And definitely, baby.
Mate.
Yo,
Miss Medamasi. Okay.
All right.
Okay.
And see, come on, Dr. Elliot Tannor, an artist, senior lecturer and consultant, a nephrologist, Department of Medicine, School of Medicine and Dentistry. Our Ken USD in artist and permanent kasa ewa ha edio nye easy